Good afternoon, and thank you for joining us for this live update on COVID-19. Today, we're joined by ChristianaCare's Associate Infection Prevention Officer, Dr. Stephen Eppes. Dr. Eppes, thank you so much for taking the time today.
My pleasure, Megan.
There's so much to continue to talk about COVID. It feels like we're continuously having the same conversation, yet new things are constantly popping up. At the time we're streaming this, all 3 counties in Delaware are at a high level of community spread. Our neighbors in Cecil County, Maryland, and Delaware County, Pennsylvania, Chester County, Pennsylvania, all sitting in yellow, medium spread. So can you explain what this means and why we should be paying attention to that map?
So the CDC uses 3 metrics to determine the level of community transmission. So one is the number of new cases that are being reported. One is the number of hospitalized patients. And the third is the percentage of hospital beds occupied by COVID patients. So using those 3, we get the designation now of high. So in the first metric, we probably are undercounting the, so many people test at home now, and those don't necessarily get recorded or reported. So there's a lot of COVID out there. If you look at Delaware data, we have about 330 cases based on the 7-day average. We have a kind of a slow but steady uptick in our hospitalization rates. Nationally, 125,000 new cases a day and 300 or so deaths a day. So yeah, there's a lot of COVID. And I think the designation of high makes a lot of sense based on the numbers, but also when you have high community transmission, there's several things that we're all supposed to do, such as wear masks in indoor locations. That's not a mask mandate. That's just what's encouraged. Try to use good ventilation in indoor settings, and everybody should stay up to date with vaccines. So that's what that high level means.
So let's flesh that out a little bit. Health officials are now recommending those of us in Delaware put that mask back on when we're going to indoor settings like the grocery store or other places. A lot of people kind of left that mask in the car months ago as these numbers continued to ebb and flow. Why is it so important that everyone put that mask back on right now?
The gym I go to, there was a gentleman that came in a couple of months ago with a sweatshirt on that said, "Masks don't work." And I'm afraid that there are people out there who have that belief, but I'm here to tell you that masks do work. There's a lot of science behind masks. I've learned more about masks in the last 2.5 years than I thought I'd ever have to know. But a good study from California, and that was published by CDC, showed that plain old cloth masks, which a lot of people wear, reduce your chance of COVID by about 56%. Surgical masks, like the one I've been wearing for most of the pandemic, reduces your rate even further, like 66%. And if you use a K95 or an N95, that is about 83% protection. So yeah, it's time to really mask back up. That's one of the best ways to protect ourselves. We'll get to vaccinations, I'm sure, but it's one of the most important tools in our toolbox to defend against COVID.
So let's make that transition to vaccinations. Getting vaccinated is, the best tool to protect yourself against COVID. But it seems like this new subvariant of Omicron, the BA.5, is hitting everybody, even those who are fully vaccinated, maybe are wearing their masks. So can you explain how that works and really the severity of this new subvariant?
Yeah, BA.5 is, and it's not just BA.5, but it's the one that's most common now. Is very contagious, as everybody I'm sure knows by now, and it has the property of immune evasion. And what that means is that even if you've been previously vaccinated, or if you've previously had the disease, you don't get great protection against BA.5. Now you get some for sure, especially against severe illness. So it's the problem of immune evasion, contagiousness, and the other problem is waning immunity. So we know that over months, the immunity you get either from natural infection or vaccines tends to wane a little bit over time. So that's really what's happening. And that's why BA.5 is taking off like it has. So, we're going to be dealing with this for the foreseeable future.
And vaccines are now approved for 6 months and older. You are a pediatric infectious disease specialist, so you know all about the childhood vaccines. You're working directly with these kids who are being vaccinated. Talk to me about why that's so important. There are so many parents out there who were hesitant about getting their young child vaccinated, but why should they move forward with that?
Yeah, I think the numbers are kind of alarming if you look at them. So for kids 12 and older, 12 to 17, we have about 60% that are fully vaccinated. That's 2 shots, the primary series. For kids 5 to 11, it's down around 30% who are fully vaccinated, meaning 2 shots. And then, of course, just in mid-June was when the approval and recommendation came out for kids 6 months to 4 years, through 4 years. And we're doing even worse than that. It's kind of interesting. If you go back to around the first of the year, there was a survey that showed that most parents, just a little over 50%, were either definitely or probably going to vaccinate their young children. And then when the vaccine actually became available, there was a lot of cold feet out there. And there are probably reasons, various reasons that people want to wait. Nobody wants to be first in line, or a lot of people don't want to be first in line. People are worried about long-term side effects. Well, I'm here to tell you that there really aren't any long-term side effects. If you look at all the vaccines that are available now in the modern era for both pediatric patients and adult patients, there are no long-term side effects. Does it worry me that people aren't getting their kids vaccinated? Yes. Less than 3% of children 6 months to 4 years have been vaccinated at this point in time. Yet we have a lot of COVID in that age group. There have been over 14 million cases reported of kids with COVID. I'm sure it's a lot more than that because many aren't tested or tested at home. But tragically, we've had almost 500 deaths in kids less than 5 years of age, 500 deaths, which would largely be preventable using vaccines. So vaccines are safe and effective for all age groups. In terms of safety, the COVID vaccines have undergone the most intensive safety monitoring of any vaccines in U.S. history, basically, U.S. history. And they're effective. They prevent illness, but more importantly, they prevent severe illness. They prevent MIS-C, the multi-system inflammatory syndrome that children can get. They prevent long COVID, and they prevent death. So it just makes sense to get your kids vaccinated. And the more people we get vaccinated, children and adults, of course, the less transmission we'll have.
So you mentioned that there's no long-term side effects. I know a lot of people are also concerned about those short-term side effects, getting their kids vaccinated, but are they really any different than the flu shot and the range of other vaccines that kids get at such a young age?
No, not really. I mean, the most common things that are reported are injection site pain, soreness, in other words. Some people will get some mild systemic symptoms like, fatigue, headache, achiness, things like that, all of which goes away within, a day or two. I suspect that most of your viewers have had the vaccine and can attest to the fact that they're mild and go away relatively quickly. People worry about the myocarditis, pericarditis that has happened mostly in teenage and young adult males. It has not been a problem in 5 to 11-year-olds. And now we've had over several 100,000 doses given out to young kids, less than 5, and there's been no cases of myocarditis or anything unexpected, really. So in terms of safety, I think these vaccines are, as good as most and better than some.
So let's move on to boosters. We do have a question that was submitted from a member of the public and one of our viewers. Thank you so much. We'll get to your question in 1 minute. Dr. Eppes, let's start with a brief overview of what boosters are available and who can get them.
So, when COVID vaccines rolled out, we weren't sure that boosters were going to be required, but we did determine that there is this phenomenon of waning immunity. Shouldn't have been a surprise. If you look at almost all pediatric vaccines and some adult vaccines, we give boosters, right? And we call it boost for a reason, because you get a major increase in immunity after a booster dose. It's many times the antibody level, for example, for some vaccines, including COVID vaccines. So there's a lot of good science behind it. Currently, anybody 5 and over is eligible for a booster. People who are 50 and over are eligible for 2 boosters. Having said that, less than half of adults who are eligible for a booster have gotten one. And if you look at Delaware data, two-thirds of our cases that are being reported and 2/3 of people in hospital are among those who've been unboosted. For immunocompromised people, they get a 3-dose primary series followed by 2 boosters. So, giving boosters has acknowledged the fact that, people over 50 and, immunocompromised people are at higher risk. So obviously boosters are a good idea. If you look at under 50 who aren't immunocompromised, there's been some controversy around that group. And, if you remember, the federal government just a few weeks ago was saying we might be targeting under 50 for a second booster. And then they kind of reversed course and said, wait a second, we're going to recommend that we hold off on that group. And the idea here is that in September, which is just next month, it is anticipated that both Pfizer and Moderna will have a new bivalent booster shot, which contains the original strain and the Omicron strain. And obviously that's desirable. And the Omicron strain, by the way, will be the BA.5. Now, obviously that's desirable to give you the best immunity against currently circulating viruses. So the question that a lot of people are asking is, should I wait for that or should I, get my booster now? So somebody who's never been boosted, you should get it now, because you probably don't have very good protection. Somebody who's been, and this is my opinion, somebody who's been boosted with 1 shot and perhaps has had the infection, they might consider waiting. It's just going to be a few weeks until we have the better vaccine. Regardless, if you get boosted now, today, for example, it will not make you ineligible for the new bivalent one. It just might make you have to wait for it, because we don't want to give them too close together, because there might be interference and you might not get as good a response.
And Dr. Eppes, you just answered Linda's question perfectly without me even asking for it. She asked about, if I get the booster now, how long will I have to wait before getting the booster that's supposed to come out in September? So Linda, I hope that answered your question. If you have any follow-ups, please continue to talk with us in the chat and we'll be happy to readdress anything that you may need.
Well, add on to that, for me, it's been a little frustrating because the government really hasn't spelled it out in terms of what the wait time would be, and which I do think it, figures into people's decision making. But hopefully, in the coming days and weeks, we will know more about that, what the grand plan is. But I'm hoping that a lot of people who haven't been boosted or who are otherwise eligible will step up and get the bivalent booster, because quite honestly, I think if we don't get enough people boosted and we don't use enough of these, we might be headed for another awful winter.
Well, let's transition right into those who have gotten COVID recently. We have a question from Pete, one of our viewers. If you are recovering from COVID but still test positive on a rapid on day 10, do you have enough active viral load to be contagious?
The rapid test that most people are using at home are antigen tests. Most people clear their antigen by 10 days. Of course, some people might keep it longer, especially if you've taken Paxlovid. Look what happened to our president with the rebound. But in terms of culturable virus, meaning live virus that we can grow in the laboratory, it's almost always gone by 10 days, unless people are immunocompromised. So you're probably not contagious to any significant degree, even though you might test positive. And by the way, if you have just had it, once you're out of isolation, you're eligible to get a booster if you need one, but you may choose to wait up to 3 months, is what the authorities say, based on the fact that you'll probably get some immunity from natural COVID.
Thank you so much for your question. And if you have any other questions for Dr. Eppes, please continue to put them in the chat. Dr. Eppes, let's stay on the positive COVID train for just a second. If someone thinks they may have symptoms and they took an at-home test, but the at-home test says negative, what is the best path forward from there?
Well, happened to me back around the winter holidays. If you test too early, you're going to get a false negative result. Once symptoms are present for at least 24 hours, the tests tend to perform pretty well, and you can, much more reliably get a positive result. I'm sorry, there's a second part to your question?
Just what the best course of action is. So what did you do when you got that negative test, but you were symptomatic?
Well, and I think this would apply to a lot of your viewers. I knew I'd had a potential exposure, so I stayed home, and sure enough, the next day my test was positive, and that's what I would recommend for others. Because if you go out and go to work or go to the gym or go to the store or whatever and don't use a mask, you may be spreading it to other people, and that's the last thing we need.
Absolutely. So if families are thinking about taking that last big summer trip, we have a few weeks left in August, what should they be doing to keep themselves and anyone that they see on their trip safe?
Well, first of all, I would say that anybody who can take a vacation should take a vacation because it's fun and we need it for our mental and physical health. If you're going to be spending most of your time outdoors during your summer vacation, outdoors is a very safe place to be. You don't get much COVID transmission outdoors. If you're indoors and you don't know who you're with in terms of their infection status or their immunization status, you probably should wear a mask to be safe. Now, who wants to get your vacation spoiled by COVID? So my office mate, I don't think he'd mind if I shared this, went on vacation a couple of weeks ago, and of the multiple family members who went on vacation, most of them wound up getting COVID, and it ruined their vacation. Just in terms of having to isolate and not have some of the fun that you were meaning to have. So yeah, outdoors as much as possible, mask indoors, hand hygiene, distancing, the stuff that we've been doing for 2.5 years would apply. And I hope everybody who's taking a vacation has a great time.
Absolutely. And Dr. Eppes, before I let you go, I know you've given this message a few times in this interview, but let's just one last time, what is the most important thing people should be doing right now as we continue to face COVID?
If you haven't been vaccinated, get vaccinated. If you haven't been boosted, get boosted. And pay attention to the coming developments. It's rapidly changing landscape. There's going to be, I'm sure, new recommendations for vaccines and other things. So keep yourself abreast of the facts.
Dr. Eppes, I'm sure we will speak again in the coming weeks and months. And if you're watching and have any other questions, please continue to submit those in the comments, especially if you check us out after the live has ended, and we can chat with you in the comments and get those answers back to you. Thank you all so much and have a great Friday afternoon and a great weekend.